The following is a presentation of Muddy River News.
Your financial needs aren't independent of each other, so your financial advisors shouldn't be either. At Mercantile Bank, our experienced United Wealth professionals are united to serve you and your complete financial planning and wealth management needs. Are you just starting your investment journey or need to roll over a retirement plan? Do you need to plan for a loved one with special needs or for your own life after work? Maybe your business needs a succession plan or you want to enhance your employee benefit programs. Whatever steps you need to take, our United Wealth experts are ready to take them with you. Together, we are united.
Hi, this is Ron Kinshirf with Muddy River News. Welcome to the Business Spotlight, brought to you by Mercantile Bank. We are joined by Dr. Jose Torres from Hannibal Regional Hospital, a thoracic cardiosurgeon or cardiothoracic surgeon.
Cardiothoracic surgeon, yes, sir.
And you have just performed the first open heart surgery at Hannibal Regional.
Yes, sir. Last Tuesday.
All right, so first of all, why did you choose that specialty when you could have picked any other specialty as a doctor?
The intensity.
Seriously?
Yes, sir. I was born in the state of New Mexico, 3 younger brothers, 22 guy cousins. Right. So, we always wrestled, roughhouse. We're always at the doctor. And it was just my personality, it's just always, rough and tumble. Always got sutures, that kind of stuff.
So by nature, okay, don't take this the wrong way, but by nature, are you extremely confident and cocky that, I'm that good at something like this that I should go for something like this?
I was raised to be confident.
Okay.
Yes, sir. I also loved art and, the technical aspects of art. So it's just, my personality. I wrestled growing up.
Oh, wow. Okay. You like the competitiveness of
yes,
this.
Sir.
So do you remember the first time you actually had a heart in your hands?
Yes, I do. I was a surgery resident at the University of Iowa.
How old were you?
Well, I was, oh my goodness, in my early 20s.
Okay, so what was that experience like? And were you surprised by, or did you know going into the surgery that you were going to be doing that?
I was on the CT surgery rotation, so they asked me to assist with the case. It was one of my mentors, Dr. Wayne Rickenbacher at the University of Iowa. And I was pretty, intimidated because he was a well-respected surgeon there. And but yeah, I thought it was the coolest thing, ever.
So were you nervous? Were you like, oh my gosh, I'm not? So I guess all your training prepared. It's like a baseball player, I guess, first time he hits in the major leagues type situation, or?
Yeah, you expect to do well.
Okay. All right. So you have created the practice at Hannibal Regional Hospital. So what is all involved in doing that?
So I was first introduced to Hannibal because my wife is originally from Quincy.
Okay.
So some of her relatives said, hey, you got to speak to these guys in Hannibal. They're interested in starting a program. I met with them, and this was many years ago. And at that time, none of the infrastructure was developed. I mentioned, hey, develop the infrastructure, an operating room, upgrades to the facilities. And then, last year, actually 2 years ago, I just happened to circle around, and, we talked to them, and they're like, hey, we've invested in the operating room. They've hired lots of nurses, the cath lab. So I was like, my belief is, if the good Lord wants you to do something, it was an opportunity, and we took it. So
they'll point you in the right direction then.
Yeah, that's my total belief.
So is the operating room for what you do different than an operating room for what other doctors do?
It's bigger because we have to have, the perfusionist team.
What's a perfusionist team?
So they're the guys who run the heart-lung machine.
Okay.
Which allow me to stop the heart in the lungs.
Oh, okay.
To do the surgery.
Okay. What else do you need? Do you have a room for those guys?
Yeah, we have room for those guys. We have a special anesthesiologist, so a cardiac anesthesiologist. I have special PAs who harvest the vein from the patient's leg. It's a special scrub team.
Right.
So it's a whole team.
Okay. So did you bring all those people in, or were they prior to you getting there?
No, I was fortunate enough to help bring the educators for the operating room. Her name's Jerry Jones. She was with me in Prescott, Arizona when I worked there many years ago, and she just happened to retire, to Missouri. So I called her up and said, hey, would you be willing to help me? So she said, yeah. They hired her. She helped train the operating room staff. I knew the perfusionists because I worked with them when I was in Davenport, Iowa. Okay. So they came with me from Davenport.
So how long from the time you got to Hannibal Regional till last Tuesday when you performed the first open heart?
It was 4 months.
4 months, so
4 months of me being there.
Right.
But this was years of the actual institution getting things up and running.
So how do you select the first patient for this?
The first patient for this was a younger individual. coronary artery disease. We tried to make sure they weren't too high risk because, as you know, it's a big distribution in terms of, illness. Heart disease is heart disease, but there are some people with blockages and there are some people with like full-blown heart failure.
Right.
So our first patient, he's a younger gentleman from the region. We did a 4-vessel bypass on him, and it went well.
So stents occur. I actually have a few stents. So
Yes,
stents
sir.
occur, and then you did a bypass. So how do you determine when the stent is required versus the bypass?
It just depends on the anatomy, usually. So if somebody has an acute or a heart attack, they want to get to the, cath lab, and you want to get that muscle perfused with blood right away.
Right away, yeah.
But sometimes, the anatomy, sometimes it's at, if there's a bifurcation or where another vessel comes off, sometimes, surgery is indicated. And there are many patients that open heart surgery is actually the better option in terms of long-term patency.
Okay. So basically, are you solving the same problem then?
Solving the same problem, just different method.
Okay. Outside of what you just described, are there other open heart type surgeries that you guys will be doing, or?
We valve replacements, valve repairs. We work on individuals with dilated or ruptured aortas.
Okay.
We work on atrial fibrillation. So that's when the heart has an abnormal rhythm.
Cardioversion type things?
It's more like ablations.
Okay.
So surgical ablations.
Okay.
We can ligate the atrial appendage.
Okay. So prior to the last Tuesday, okay, here's another question. So how many of these type of surgeries had you done up in Iowa?
I was averaging about 150 to 200 a year.
Okay. So had you done one prior, the 4 months prior to doing the one on Tuesday?
Yeah, so what I was
Okay.
doing, yes, sir. So while we were doing this, I was going back and forth between here and Iowa
Right.
to, keep my skills up.
So is it like riding a bike, though? If you hadn't done one for 4 months, would you have been comfortable going in and taking care of this young man?
It is kind of like riding a bike, but you want to keep your hands in it. You know what I'm saying? It's kind of
No
like
pun
an athlete.
intended.
It's kind of like an athlete.
Right.
You got to, it's that muscle memory.
All right. So what is the margin of error for you when you're doing these type of things?
Very small.
So aren't you a nervous wreck?
I stress before, during, and after the case. Yes, sir.
Okay. So
But-
there is I would assume the anxiety is helpful to you because
It's the adrenaline.
it keeps you a little sharper than maybe you would have been. But
Yes, sir. So,
Man.
yeah, it is. And I'm more stressing about the team
okay.
and the patient. So it's a lot of different things that the
Yeah.
surgeon stresses about.
Okay. All right. So you have any superstitions prior to surgery? Do you wear the same socks? Do you have the same cap that you wear? Anything along those lines? You're a former athlete, so I would assume you have some superstitions.
The same, type of shoes I wear.
Well, that
type of
doesn't
Merrells.
count.
But I don't, honestly, no. I don't know. My belief is, that the good Lord keeps an eye on us all, and
Right.
will guide us.
All right. Do you listen to the same music every time? Or do you
Yes.
listen to music in the surgery?
Yes, sir, I do.
Okay.
When I open up whenever we start, it's usually like, rock and roll, heavy metal.
Oh.
My 5-finger death punch.
There you go. And then does it progress to different
And then
things?
it progresses, and then with the nurses, like, they're more contemporary,
Oh, you let them choose.
I let them choose. Yeah.
Okay.
It's a team effort. Everybody's got to be happy.
But at the start, though, it's pretty heavy.
Yeah.
Okay.
It's the rhythm and the cadence.
Okay.
It sets it up.
So how careful are you with your hands? I mean, do you work around the house, or do you wear gloves constantly?
No, I work around the house. I do work with power tools. I won't work with a table saw. I've seen a few.
Well, you do that when you're doing surgery,
Or
don't you?
surgery.
Isn't that what you open the chest
It's
with?
more
a table
like
saw?
a sawzall.
Okay. Okay.
Yeah. I also do Brazilian Jiu-Jitsu.
Oh, do you really?
Yes, sir.
Okay. So that can't be good. I mean, if you jam a finger, can you work?
Depends on which finger.
Really?
Yeah.
Okay.
No, I'm fairly careful.
Okay.
I do the old man stuff now. I'm more coaching,
Okay.
instructing.
Gotcha.
Not like I
Gotcha.
was when I was younger.
So what does a cardiothoracic surgeon? Well, I was going to ask you what you do in your off time, but you do jiu-jitsu or help with
Jiu-jitsu.
kids doing jiu-jitsu.
Yeah, so I have 2 boys and a girl, so I take them to jiu-jitsu or wrestling
Right.
practice. I also love painting and drawing.
Oh, really?
Yes, sir.
Okay. Are you? Do you sell those type of things, or is it just more just for yourself to relax?
I have done some commissions in the past when I was in
Okay.
Arizona. But
Okay.
since I got out here, I've tried to focus more on establishing the program.
Okay.
And eventually, I'd like to get back into doing that. So
You've got
cartridge.
one. You've got one done. Do you have others in the pipeline?
We have several in the pipeline. Yes, sir.
It's got to be exciting to start something like this.
It is exciting. It is nerve-wracking, but I'm trying to keep people realistic because everybody's like, oh, we did the first case. That's just the first one.
Right.
And we all got to get, keep our skills up and get better.
Well, welcome to the area. Thanks for coming in.
It is awesome to be in the area. Thank
awesome.
you.
Thanks. Dr. Jose Torres, Hannibal Regional Hospital, just completed the first ever open heart surgery over at the facility.
Yes,
All
sir.
right. This has been the Business Spotlight brought to you by Mercantile Bank. I'm Ron Kincher for Muddy River News.
Your financial needs aren't independent of each other, so your financial advisors shouldn't be either. At Mercantile Bank, our experienced United Wealth professionals are united to serve you and your complete financial planning and wealth management needs. Are you just starting your investment journey or need to roll over a retirement plan? Do you need to plan for a loved one with special needs or for your own life after work? Maybe your business needs a succession plan or you want to enhance your employee benefit programs. Whatever steps you need to take, our United Wealth experts are ready to take them with you. Together, we are united.
Muddy River News. Our home, our news.